welcome to the channel. Is a kid having ADHD or is just being a kid? Today we're going to talk about the difference. I'm Rita and today it's all about you. ADHD stands for Attention Deficit Hyperactivity Disorder. It is a mental disorder of the neurodevelopment type. It is characterized by having difficulty of paying attention, too much activity or activity without really being conscious or be regardless of the consequences. And these behaviors are not really appropriate to the age of the child. In this situation, the child cannot really pay attention and cannot focus or in any kind of thing or in any kind of situation. The causes for ADHD, they remain not very clear. Some studies say that it can be genetic or hereditary. Others can say that when there are an exposure to some chemicals or some toxins, this can happen to the child. But this kind of behavior doesn't have nothing to do with too much sugar, too much video games or too bad parenting. There are three types of ADHD. Primary hyperactive, which is the impulsive type. Primary inattentive, or the other type is the combination between these two. This is a medical condition that really affects self-control and auto-control, difficulty of staying focused on one thing or one situation or one task, and a visible immaturity or a visible delay in the brain development. In children, when children are inattentive or when ADHD creates this inattention situation, you can see that the child is easily distracted, doesn't follow any kind of tasks or rules, don't really pay attention. It looks like this child is not is not even there, which make them make certain mistakes that they are very basic. These kind of children, they have many problems organizing their tasks, easily forgetting daily routines, can't really stand still in most of the activities. They are always bouncing or moving a part of his body. They talk too much and they move too much. They cannot really be still for a moment. But this is not just typical from children, or what I mean is that ADHD can happen in adults too. In this case, the main symptoms are chronic forgetfulness, anxiety, low self-esteem, frustration, trouble concentration, depression, anxiety, mood swings, unorganized, easy to have an addiction, trouble controlling anger, trouble controlling the own body and some reflex of the body, trouble in the working place, and social relationship problems and even intimate relationship issues. A person with ADHD can be very successful in life, can achieve anything that she wants to, but without the proper treatment and without paying attention on the medical side, it's much more difficult. School failure, family stress, depression, relationship problems, substance abuses, delinquency and job failures are some of the things that can happen if you don't treat this disease. So for all of that, it's necessary to have a really good diagnose that really gives you the right treatment for each case. But aren't we just overdiagnose ADHD? Aren't we just giving too much stimulus to our children and then just label them and totally forget what they should be and what kind of behavior kids must have? Taking the US example, every year there are lots of meds for ADHD, and 1 in 5 children are having this kind of diagnosis. I consider that the big difference is in the diagnosis. So a kid with ADHD, it has the same kind of behavior in school and out of school, at home or in any other places. So it's important to define these kind of behaviors if they are behaviors that they are more or less the same during a whole day and in any situations that the kid can be. These signs or these situations where the kids are really distractible, they are not attentive, or they are too impulsive. These are typical syndromes most of the times of boredom in the classroom, and maybe we have to analyze and make an evaluation if the classroom environment is really the best for these kind of kids, and if the classroom environment is careful enough to understand that there are kids that they are a little bit more calmer than others, and they are a little bit mature than others, and this difference doesn't mean that these others have ADHD diseases. Maybe this difference just make us remember that kids are just being kids. As a parent, and before you listen any other person telling that you have to take care of your child, you have to observe your child, you have to analyze all the situations, and you have to trust your guts. If something in you tells you that your kid is an healthy kid, or if your kid is somebody that you consider that it's all the time too much nervous, too much impatience, too much active, take a step down and try to analyze if this is something that it's not normal. So I will leave you with some tips, because nobody knows your kid better than you, and these tips can help you to manage your thoughts and analyze your kid's behavior. Inform yourself about ADHD meds and what this kind of medicine do to a child. Most of these medicines doesn't work on the long term, so be aware of what kind of medicines your kid need. If you need, and if you take that, if you have the time, take a course, a parenting course or a teacher course, because most of the times you can help your kid with different kind of activities, develop another kind of maturity, try to make him be a little bit more attentive, try to be more concentrated, try to have focus, and try to overcome all the negative situations. Try to not label your child, not in front of him, and try to talk with him about his own behavior and what his behavior is producing in the family dynamic, in the school dynamic, and what he thinks about his own behavior. If a child likes to run, to move, to jump, just do it with him. Sometimes they just want somebody to be with them and to do the same activities, even they look dumb to you. Just do it. Sometimes the best way of being with your child and make him feel protected and make him feel connected is doing these kind of things with him. In order for your kids to feel safe, it's very important that you can have a good environment at home for him. So, because kids usually goes run by rules and run by example, they just want you to make them feel safe. And having a lovely and a cozy and a safe environment is the best thing for this kind of feelings. It's important for you to be a role model in a way that you can easily apologize, you can be polite with your child in order for him to understand that everybody can make mistakes, but everybody can be polite and can be nice to each other, even if it's his own family. Learning this kind of behaviors, he will tend to follow the same behaviors when he is not at home, when he is in school, when he is with friends, and in some other situations. And that's all for today, guys. I hope you like it. I hope you leave a thumbs up, subscribe to the channel, share with a friend, comment if you want, and I'll see you next time. Bye!